Hey everyone, today we are going to discuss about adequacy of hemodialysis. First of all, introduction of adequacy of hemodialysis. Introduction: the term adequacy of hemodialysis refers to how effectively and efficiently dialysis treatment clean the blood and maintain the patient overall health and well-being. The adequate dialysis helps the patient feel better and improve the quality of life, that reduces the complications and decreases the morbidity and mortality rate. The assessment of hemodialysis adequacy is important too because insufficient dialysis can lead to the complication such as fluid overload and the other factors electrolyte imbalance, malnutrition, anemia, hypertension and fatigue or cardiovascular problem. Therefore, the regular monitoring ensures that the patient receives the correct amount of dialysis according to the individual need. Next one, we will discuss the definition of hemodialysis adequacy. The dialysis adequacy is defined as the minimum amount of urea clearance and nutritional intake that prevent adverse outcomes. The adequacy of dialysis refers to how well we remove the toxins and waste products from the patient blood and has major impact on their well-being. The aspects of dialysis adequacy means clinical control of anemia, then acidosis control of bone disease. Next one is control of blood pressure, relief of uremia, then symptoms, quality of life and life expectancy. Next one, the measurement of hemodialysis adequacy. It included small solutes clearance and urea kinetic modeling. Kt by V, the urea reduction rate means URR. How do we know if the patient adequately dialysed? The National Cooperative Dialysis Studies (NCD) means established the urea kinetic modeling or accepted methods of measuring small solute clearance. Next one, this clearance of urea has been selected as the basis for all calculation of dialysis adequacy. The urea clearance factors included urea clearance coefficient of dialysis, then the pre and post treatment blood urea. The treatment time means the total body water and the ultrafiltration, then the residual renal function and the intradialytic urea generation rate. These are the factors including urea clearance. Next, what is urea kinetic modeling? When the calculation of dialysis adequacy use both the urea clearance and patient nutritional status. Therefore, the examples are urea generation rate. This is called UKM. It takes in the account residual renal function. It's predicted the dialysis and clearance. Then the blood and dialysate flow, times of dialysis and fluid removal. Next, the urea clearance kinetic modeling. It's the method of verifying that the amount of patient prescribed the KTB, KTB and this equals of the amounts of dialysis delivered. The effective KT by V and it refers to the variation of dialysis times. And it included the uses of the factors included urea kinetic modeling as use of larger and high efficiency, then the high flux dialysis and the optimization of dietary proteins. These are the factors are included the urea kinetic modeling. Next, urea reduction rate is calculated as following. First one, the pre-dialysis urea minus post-dialysis urea or pre-dialysis urea into 100. These are the measurement of used in hemodialysis patient. Then the simple predictions of mortality. The limitation of urea reduction rate does not account for the contribution of ultrafiltration to dialysis dose. Next, let me explain what is KT by V. Then Kt by V is equal to fractional urea clearance. And the K is dialyzer clearance, ml per, it refers to the ml per minute or L per hour. Then the T means time, minute or hour. V means distribution volume of urea. The unit included ml or liters. The K stands for the dialyzer clearance and the rate which blood passes through the dialyzer. It expressed in the milliliters of per minutes, ml per minute. The Kt, the top of part of the fractions, is clearance multiplied by the time. It representing the volume of fluid completely cleared of urea during the single treatment. Next, the SPKT by V. It means the single pool. Then EQKT by V. It is known as equilibrate and or double pool. Then STD KT by V. It means weekly standard. The urea KT by V value is less than 0.8 was found to be associated with the high likelihood or morbidity or the treatment failure, while Kt by V refers to increases 1.0 was associated with the good outcome. The guidelines have recommended a minimum Kt by V value of at least 1.2 of hemodialysis patient being dialyzed 3 times per week. Next, the advantages of Kt by V. The Kt by V include both are mathematical linked. They are derived from pre and post dialysis burn levels of then, but Kt by V also takes in account the ultrafiltration urea, and Kt by V was endorsed by NKF KDOQI. It means dialysis adequacy measurement of choice for providers and unable to perform the formal UKM. Next, we checking the dialyzed dose of dialysis. The dialysis dose is usually monitored on a monthly basis, it's according to KDOQI guidelines. The pre-dialysate is dropped before injecting the heparin or saline or other potential dilutes. Then its post-dialysis include draw blood from the dialyzer, inflow after following slow flow technique or stop dialysate techniques. Next, we are adjusting the initial dialysis prescription. Delivered SPKT derived from the measures of URR often will vary considerably from the months to months despite no apparent changes in the therapy. It used to first one laboratory errors in measuring the burn values, then possible variation in how the post dialysis drawn. Next one, the actual variation in actual section length. Then tin averaged blood flow rate and dialyzer clearance. The last point is average SPKT by V value from the 3 monthly 3 determine whether or not standard the minimum 1.2 is being delivered. Next, limitation of URR, urea reduction rate. The limitation of urea reduction rate does not account for contribution of ultrafiltration to final delivered dose of dialysis. It's less accurate. The errors in delivered dose of HD means hemodialysis, it may be particularly difficult to detect in target ranges of urea reduction rate. It's increasing the 65 percentage where the relationship exists between URR and KT by V. Then we correcting the observed deficiency in URR, urea reduction rate, and it require empirical modifications of components of treatment prescriptions. Then the limitation of urea reduction rate does not support the calculation of NPCR and contribution of residual renal functions to clearance. Next, what is Bunn level? The Bunn level means blood urea nitrogen. Urea is the substance most often monitored in the clinical practice because it is small and readily dialysed solutes that in bulk catabolite or dietary product. Then its constituents is 90% of waste nitrogen accumulated in the body water. It is easily measured in blood and the fractional clearance of urea in blood was correlated with the patient outcome. The BUN stands for blood urea nitrogen with a normal kidney function. A person have BUN in blood urea nitrogen in the range 8 to 25 mg per dl. Next, we discuss about multi-dimensional dialysis delivering system. Then the general consequences that increases in the dialysis dose measurable by small molecules and the clearance alone are unlikely to major evidence in the patient health and survival. Then the dialysis schedule, duration and management of extracellular volume and hypodynamic ranges of solute larger than urea, creatinine or urea of investigation. Next, what is the biochemical adequacy? The biochemical adequacy study have shown that the wide fluctuation in solutes and the inability to remove the appropriate amount of retention. The toxins are the causes of inadequacy of HD. The potassium higher risk when the both serum potassium level are sudden leads to cardiac arrest. It lowest part of 5. The mineral bond disorder means the most phosphate intracellular with only a small amount removed by dialysis, particularly it during hemodialysis short. Then the conclusion of this adequacy, hemodialysis adequacy is an important measure of the effectiveness of dialysis treatment. In removing the waste products, we can remove the excess fluid and toxins from the body. The adequate dialysis helps improve the patient health, reduce the complication, and it enhance the quality of life and decrease the morbidity and mortality rate. And then it regular assessment during parameters such as KT by V and the urea reduction rate. It means URR. It is also known as URR. Then ensure the patients receiving optimal dialysis therapy. Then it continuous monitoring and we can get individualized treatment adjusted and are essential to achieve and maintains the adequate hemodialysis outcome. Thank you.